Many people rely on prescription medications to manage various health conditions. While these medications can be effective when used appropriately, combining them can lead to potentially dangerous interactions. It is crucial to understand the risks involved before mixing medications, especially those with sedative effects or those that act on the central nervous system. This essay will delve into the specific risks associated with mixing methadone, Ritalin, Zopiclone and mirtazapine, highlighting the importance of seeking professional guidance for safe medication management. It's essential to remember that every individual reacts differently to medications. What might be safe for one person could be extremely risky for another. Factors such as age, weight, metabolism, and existing medical conditions can influence how medications are processed by the body. This makes self-medicating and mixing medications without consulting a healthcare professional incredibly dangerous. The potential consequences of adverse drug interactions can range from mild discomfort to life-threatening situations. These interactions can alter the intended effects of the medications, leading to reduced effectiveness or even toxicity. Therefore, it is paramount to prioritize open communication with your doctor and pharmacist to ensure your medication regimen is as safe and effective as possible. Before delving into the specific risks of combining these medications, it's important to understand each drug individually. Each one has its own unique properties, purposes, and potential side effects. Methadone is a powerful opioid medication primarily used in the treatment of opioid addiction. It works by binding to opioid receptors in the brain, reducing cravings and withdrawal symptoms. Side effects can include drowsiness, slowed breathing, constipation, and nausea. Ritalin, also known as methylphenidate, is a stimulant medication commonly prescribed for attention deficit/hyperactivity disorder or ADHD. It works by increasing dopamine and norepinephrine levels in the brain, improving focus, attention, and impulse control. Side effects can include insomnia, anxiety, decreased appetite, and increased heart rate. Zopiclone is a non-benzodiazepine hypnotic medication used for the short-term treatment of insomnia. It works by slowing down brain activity to induce sleep. Side effects can include daytime drowsiness, dizziness, bitter taste, and memory problems. Mirtazapine is an atypical antidepressant used to treat major depressive disorder. It works by increasing serotonin and norepinephrine levels in the brain. Side effects can include drowsiness, weight gain, increased appetite, and dizziness. Understanding the individual properties of each of these medications is the first step in comprehending the potential complexities and risks associated with combining them. It is crucial to remember that this information is not a substitute for professional medical advice. Always consult a healthcare professional for personalized guidance on your medication management. Combining methadone, Ritalin, Zopiclone, and mirtazapine can lead to a cascade of dangerous interactions due to their effects on the central nervous system. These interactions can amplify the side effects of each drug, leading to unpredictable and potentially life-threatening consequences. One significant risk is respiratory depression, particularly with the combination of methadone and Zopiclone. Both medications can slow down breathing, and taking them together can severely depress respiratory function, leading to oxygen deprivation, coma, or even death. Another risk is an increased risk of overdose. Combining central nervous system depressants like methadone and Zopiclone with the stimulant effects of Ritalin can create a dangerous push-and-pull effect on the body. This unpredictable interaction can mask overdose symptoms, making it difficult to recognize and respond to an emergency. Furthermore, mixing these medications can lead to cardiovascular complications. Ritalin can increase heart rate and blood pressure, while methadone and Zopiclone can slow down these functions. This conflicting interplay can strain the heart, potentially leading to arrhythmias, heart attack, or stroke, especially in individuals with pre-existing heart conditions. It is crucial to note that these are just some potential risks, and this is not an exhaustive list. The interactions between these medications can be complex and vary based on individual factors. Always consult with a healthcare professional before making any changes to your medication regimen. Section 4. A recipe for disaster. Adding clonazepam to the mix. Adding clonazepam to the mix further exacerbates the risks associated with combining these medications. Clonazepam is a benzodiazepine medication used to treat anxiety and seizures. Like zopiclone, it acts as a central nervous system depressant, amplifying the sedative effects and risks of respiratory depression. Combining clonazepam with methadone, zopiclone, and Ritalin can create a dangerous cocktail of sedatives and stimulants. This concoction can lead to extreme drowsiness, confusion, impaired coordination, and an increased risk of accidents and injuries. The combined sedative effects of these medications can also lead to cognitive impairment, memory problems, and difficulty concentrating. This can interfere with daily activities, work performance, and overall quality of life. Moreover, the mixture of stimulants and depressants can disrupt sleep patterns and worsen existing sleep disorders. This can lead to a vicious cycle of medication reliance and further complicate the management of underlying conditions. Adding clonazepam to an already complex mix of medications significantly heightens the potential for adverse effects. It is crucial to discuss all your medications with your doctor to ensure they are aware of the full picture of your medication regimen and can advise you accordingly. Section 5. Seeking safer shores. Exploring alternative treatments for common conditions. Fortunately, safer alternatives exist for managing the conditions these medications are often prescribed to treat. Exploring these alternatives with your healthcare provider can help minimize the risks associated with polypharmacy, the use of multiple medications. For anxiety and sleep issues, non-medication approaches like cognitive behavioral therapy, mindfulness meditation, and relaxation techniques can be highly effective. These therapies address the root causes of anxiety and insomnia, promoting long-term solutions without the risks of medication interactions. For pain management, alternatives to opioids like methadone include non-steroidal anti-inflammatory drugs, physical therapy, and acupuncture. These options can effectively manage pain without the risks of addiction, respiratory depression, and other opioid-related side effects. For mood stabilization and depression, alternatives to medications like mirtazapine include psychotherapy, lifestyle changes like regular exercise and a healthy diet, and transcranial magnetic stimulation. These approaches can effectively address the underlying causes of mood disorders, promoting long-term mental well-being. For focus and attention difficulties, alternatives to stimulant medications like Ritalin include behavioral therapies, educational support, and lifestyle modifications. These strategies can improve focus and attention without the risks of insomnia, anxiety, and cardiovascular complications associated with stimulants. Exploring these safer alternatives with your healthcare provider can provide a more holistic and individualized approach to managing your health conditions while minimizing the risks associated with combining multiple medications. Section 6. Navigating the maze. Resources for safe medication use. Navigating the world of medications can be overwhelming, but resources are available to empower you to make informed decisions about your health. Drug interaction checkers and open communication with healthcare providers are essential tools for safe medication management. Drug interaction checkers, available online and through mobile apps, allow you to input a list of your medications and supplements to identify potential interactions. While these tools provide valuable information, they should not replace professional medical advice. Your doctor and pharmacist are your primary allies in safe medication management. They can evaluate your medical history, current medications, and potential risks to ensure your medication regimen is appropriate and safe. Never hesitate to ask questions, express concerns, or seek clarification about your medications. Remember, it is crucial to be your health advocate. Keep a current list of all your medications, including dosages and frequencies, and share it with all your healthcare providers. This simple step can prevent potentially dangerous interactions and ensure coordinated care. By utilizing available resources and maintaining open communication with your healthcare team, you can confidently navigate the complexities of medication management and prioritize your health and well-being. Section 7. Your health, your choice, prioritizing professional guidance in medication management. In conclusion, while medications play a crucial role in managing various health conditions, combining them, especially those with central nervous system effects, can lead to serious health risks. The potential interactions between methadone, Ritalin, Zopiclone, and mirtazapine, particularly with the addition of clonazepam, highlight the importance of seeking professional guidance for safe medication management. Remember, your health is your responsibility. Never self-medicate or alter your medication regimen without consulting your healthcare provider. They can evaluate your individual needs, consider potential risks, and recommend the safest and most effective treatment plan. Utilizing available resources like drug interaction checkers and maintaining open communication with your doctor and pharmacist can empower you to make informed decisions about your medications. By prioritizing professional guidance, you can effectively manage your health conditions while minimizing the risks associated with polypharmacy. Remember, when it comes to your health, knowledge is power and communication is key. By working closely with your healthcare team, you can navigate the complexities of medication management and prioritize your well-being.